The pathway study is yet another attempt at trying to understand, is there a role for immune therapy in patients with curative head and neck cancer who, after their curative therapy, get immunotherapy for a period of time to try to reduce the chances of recurrence. It's a complicated study. Overall, the overall survival wasn't changed. The event-free survival seemed to have a benefit. This study is a little bit challenging because it was only a 100-patient study and it was a very mixed bag. There were like 6 different ways you could get in. Some people had surgery, some people didn't have surgery. The ways that you could have high-risk features were pretty complex. It's a reasonably small trial, and the signal they showed was reasonable, not amazing. And we know there were 2 larger trials, the Keynote 412 trial and the Javelin 100 trial, large phase 3 studies that basically tried to do the same thing and were negative. So this study is another attempt. It seems to suggest that there might be a benefit to immune therapy after the completion of surgery, radiation, chemo in our highest risk patients. I don't think it's going to put it over the hump for approvals. I think the problem is that there's only some patients that are going to benefit. We need to do a better job of identifying who those are. It might be patients with higher levels of PD-L1 expression, more inflamed phenotypes of their tumor. But the point is, it is another piece of evidence that there's probably some utility to using immunotherapy. We just got to get the patients right, which, in my opinion, we're not quite there yet.